introduce the case?
Our case is 8-year-old male weighing 28 kilograms. He was asymptomatic and referred to our center for evaluation of systolic murmur. On physical examination, there was systolic murmur at upper left sternal border. ECG showed sinus rhythm. On transthoracic echocardiographic evaluation, showed a defect at septum secundum with left to right shunt. The diameter of the defect is 13 millimeter, and with color flow, it was 18 to 19 millimeter. Right ventricle was enlarged. Total septum was 34 millimeter, with IVC rim 5 to 6 millimeter and floppy, and the aortic rim measured 0 to 4 millimeter. And our intended intervention is transcatheter closure of the defect.
Or do you think balloon sizing?
You just tell us what is your routine practice. Well, personally, I would recommend balloon sizing in all cases, particularly in this case.
You recommend balloon sizing?
Well, routinely I do balloon sizing. Okay. I wonder if you do the same, or there are other opinions about that. What do you do routinely?
You see in this picture the color flow diameter is 16 millimeter. Routinely we do balloon sizing in my practice.
Uyanıyor.
Abi sende mikrofon var, eko istiyorsan konuş.
Any comments or questions from the audience? They're doing balloon sizing, or you're against, or what? Felix, you're in favor of balloon sizing.
I always balloon size.
Okay, balloon sizing.
It's a safe procedure. It gives me the confidence that I've got the right size, that there are no additional defects.
Okay.
Sometimes the shape.
Joe is in favor. Shaq is in favor. Felix.
I always do balloon sizing.
Yeah. So
I do not do balloon sizing.
Well, disregard the Shaq's opinion. Yeah, that's routine basis is do balloon sizing. Why don't you do balloon sizing, Shaq? Never. In some cases, why?
No, only a limited number of cases where the septum is very floppy, and I'm not sure whether we would get a clear size answer. Here, this is fairly rigid septum, and you've got a good information about the size of the defect on 2D as well as color. Then I would not consider balloon sizing.
Yeah, but to some extent, the floppiness of the septum is rather subjective, isn't it?
Yeah.
So you did balloon sizing anyway, yes, in this case?
Yeah, we agreed with the majority and we did balloon sizing and we find about 16 millimeter in this patient.
So similar to the basic...
Balon, floresini gösterebilir misiniz balon?
Evet, ölçtüğümüz var mı? Şu 15 falan ölçtüğümüz.
You have to decrease 2/3 of the, because of the measurement, you have to take 2/3 of the balloon sizing. It is about 24, that means 16 millimeter balloon sizing. And with good indentation.
On echo, at the same time, we had an indentation of about 15 millimeters.
Abdullah, hello. This is
Hello?
Birgül. Why do you show the measurement in the moving? Why don't you fix that measure?
We do it during fixing, but it seems...
you don't show the fixing picture.
No, that's the recorded. That's a recorded
picture. That's fine.
Yeah.
And the patient's total septum is about measuring from 32 to 35 millimeters, and the defect stretch size is about 16. Stop flow size is about 15 millimeters. So, what do you think the size of the
Then why did you
occluder?
select 16?
Well, 16 with the with the stretch size is 16, but with the stop flow technique it's about 15 on echo.
Then why 16 size device? Why not 15?
Yeah, no, we are just asking what size device would you use?
Which you prefer, 16?
I would use 15.
On the other hand, we don't have 16. We have either 15 or 16 and a half because we prefer to use in the Figula Flex 2 ASD occlusure, and it has a number increasing 1/2, 1/2.
Okay.
So
we have 15, 16 and a half.
We decided among ourselves that we should go for a 15 device.
Yeah.
So what is this number in saying 25.6 millimeter?
It's for calibration.
Abi oradan bir
They
göstereceğiz.
divide by 2, I think, or
Ekoyu gösterebilir
it's a
misin?
calibration factor.
The markers.
I'd like to ask
Ama sen
Dr.
gösterme.
Qureshi,
Gösterme, gösterme.
if
Gösterme.
Dr. Qureshi, may I ask you,
Balon sizing.
if you would not do a balloon sizing, and I think the same, if the rims are firm, I usually don't. What would the size you select?
Well, here on the color, it was 15 and 2D was 14.6. So I would have picked either a 15 or a 16, depending on which device you're using. Occlutech will be 15 and Amplatzer would be 16 or 14. So
Would you add 2 or 4?
not in, this is
Okay.
fairly firm rims, whereas if you have floppy, then yes.
In floppy, you add 4, or in firm rims, you add 2?
So what I do in floppy rims is there's usually a rigid part and then a floppy part, and I use the measurement of the rigid part to the rigid part and base the device selection on that. And that tends to be between 2 and 4 millimeters more than the 2D defect.
But you do balloon sizing with floppy rims anyway.
But it's only
orada
the
cihazı götürürken
it's
gösterir
subjective.
misiniz?
It's the very floppy rim,
Hayır, cihazı
Not
götürürken.
not the
Yok, yok.
slightly floppy
We
rims.
will explain during coffee break the difference between
bir sonraki.
floppy and very floppy.
We discussed here also to prefer 15 or 16 and a half. And what do you recommend?
15 I think, right?
Yeah, I think the salon recommends 15.
Okay.
that
So
fine?
yeah, they chose 15 device also, and they already deployed it actually just before we connected to you guys. And can we show the echo live? Biraz. So can you hear? Can you see the echo now?
Yes?
This is just, we haven't released the device yet, and we have some concerns about the left atrial disc pressing on the aorta.
Well, everybody disagree with that.
Okay.
They're all on the same side. Yeah,
Good.
the audience, there's a consensus of everybody in the audience that there is no much worry about that.
Okay, so you say we should just release the device.
So we take your advice
Well,
and we
excuse
release the
me,
device.
Just, what device are you implanting?
This
Can
is-
you repeat?
This
We
is
are-
a 15 millimeter Occlutech device.
Okay.
And sheet size?
8 French.
8.
So you're going to release the
Yeah,
device?
we are going to release.
All right.
Görmek isterler.
So
Şuraya bağlanın.
fluoro also.
Şu
Fluoro.
ellerini gösterebilir misiniz doktor bey? Dur, mekanizmayı göster de önce.
Did you do a push-pull
Abdullah, dur.
balloon, some test like this?
Dur Abdullah. Şunu bir görsünler elini senin.
Abi tek
No,
tek
no,
istersen.
we didn't actually, and it seems pretty stable, the device, and we don't want to push or pull the device.
Well, excuse me, why don't you use a LAO fluoral projection? Because we are,
Ele yapsana.
the device is exactly superimposed with the TOE. We don't see anything on fluoral.
Biraz daha yatır. Okay. Okay.
Do you agree with using a different fluoral projection?
Yeah, now it's LAO.
We see the echo now.
Flora'yı gösterir misiniz?
We
Aşağıda
see your
flora.
hands and echo. Can you see both echo and
Fluoroyu gösterebilir
fluoral?
misiniz?
Yok, flora'yı da görelim istiyor.
Okay.
Oh, that's much better. Yeah, thank you.
Okay, now, do you want to see the release mechanism of the flex device?
Yes, sure.
Okay.
Elimi gösterir. It
Abdullah.
has a lock mechanism. So unscrew first, and like
Yaptım.
like this, we have to push the.
Çektim, düşürdüm.
Okay.
Yeah, that's really, we saw the release.
Okay. Şimdi şeyi göster. Eko'yu göster.
Yeah, can you see the echo now? Yes, thank you, perfect.
Okay, this is now after the device is released.
Yok güzel. Eko güzel. Eko'da bir sıkıntı yok. Sadece aorta bası 16.5 olsaydı.
14 kaldırırdı.
Well, the device seems to be sitting very nicely with no residual shunt. You're happy, yes?
Yeah, we are happy.
Very good. Well, just an observation. When you, at the beginning of the transmission, you saw the echo pictures. I noticed that you may see some fluid behind the right atrium. Is that right? Can you go back to the beginning of your presentation?
Sure. Just a second, please.
Yeah, this
Yeah,
is
that's
just
true.
before doing anything. I
Exactly.
think this is an important observation, just because you are worried of that, but you have to know that this fluid is present at the beginning, and just not to be worried in inappropriate way if you see this tiny fluid during follow-up, because it can be misleading towards the question erosion or tamponade. Yes.
That's true. That's a
So I
very
think,
good point. Yeah.
As well, in our experience, sometimes by transesophageal echo, you see some fluid across the heart that you don't see clearly on routine transthoracic echo. So I think this is an important piece of observation. Do you agree?
Yeah, definitely.
Thank you,
It's
man.
a very good point. Thank you.
Thank you.
Yes, that's a question from the audience. Can you give her a microphone, please?
Left atrial disc looks thicker than right atrial disc. Is that usual appearance for Occlutech device?
Yes, it is a little bit thicker. That's true. And also, it's a soft device, and with time, you usually see that the LA disc is also getting smaller on follow-ups. That's my observation.
Well, can you show us some different projections or sections, because sometimes the appearance of the device also depends on the projections we are using.
On the other hand, the left disc has no screwing device. It's an advantage, and the other advantage of this device is it has 360-degree rotation capacity.
Yok, o kadar yok. Bak şimdi.
It's a flex device.
O kadar değil.
Can you show other projections from the echo, Abdullah? Dr. Karminat is asking for that.
Okay.
For the device to be seen in other projections.
Well, also another projection, the left disc seems to be a bit bulkier than the right. But yeah, Felix?
Well, I try to make a comment on balloon sizing or echo sizing. Due to my experience, it's very easy to create a larger defect using the color flow method. So it's only depending on the power you achieve. So I can easily create a defect between 12 and 20 millimeter in diameter, just playing with the power of the color flow. And in this situation, if you just would have used the stop flow method with balloon sizing, I'm more than sure that you only would have measured 14 millimeter. So in this situation, I think 14 millimeter would have achieved the same total occlusion as the 60 millimeter device did with the 15, okay.
13.
Okay, 1 millimeter. But you see the appearance of the left atrial disc, which is bulky. It may be bulky because it's an Occlutech, but it may be also bulky because it's 1 millimeter or 2 millimeter larger than it should be or it is necessary to be. So that is something with regard to echo measurements. I'm more than powerful supporter of balloon sizing, even though Jacques is not recommending it.
Yeah, did you hear the comments from Professor Berger? I mean,
Unfortunately, we couldn't hear.
Overestimation of the size by color flow. This is exactly true because I fully agree with you, Felix. The gain settings of the color can give very different pictures and numbers. Well, when I'm using color flow and making measurements, I prefer to see black and white and color simultaneously and make a measurement on the black and white pictures.
So do you think we could use a smaller device for this patient?
Just a bit smaller, yes.
Okay.
But it's only 1 millimeter. It's neither
it's
here
1
nor
millimeter,
there. So,
according to
but the design of the Occlutech is such that that left atrial disc will look like that, and it over a period of weeks.
So it depends on the device itself and not the size, you say, yeah.
And I was saying to Felix that in the last 5 years, the only embolization of a device I've had is where I've balloon sized first. And Felix said that the only embolization he had was when he didn't balloon size. So that is really the scientific evidence we have.
Well, how much floppy was the rim in this deep? Floppy or very floppy?
Very, very, very floppy.
Very, very, very floppy. So be careful about that.
Right. Okay.
Do you have any question and comments in Shaki speech?
So I think, well, the procedure was very successful, the result very nice, so congratulate with you. Thank you very much.
Thank you.